Now we are dealing with carbohydrates. The third major component of food is carbohydrates, and this is the main source of energy, providing 4 kilocalories per gram. Carbohydrate is also essential for the oxidation of fats and for the synthesis of certain non-essential amino acids. There are 3 main sources of carbohydrates. Vis-a-vis, you have starches, which is known as your starch, sugar, and cellulose. The 3 main sources of carbohydrates vis-a-vis starches, sugar, and cellulose. Starch is basic to the human diet. It is found in abundance in cereals, roots, and tubers. While sugar comprises monosaccharides, that is your glucose, fructose, and galactose, and disaccharides, that is your sucrose, lactose, and maltose. So, sugars comprise of monosaccharides and disaccharides. Now, these free sugars are highly water soluble and easily assimilated. The free sugars, along with starches, constitute a key source of energy. Cellulose, on the other hand, is the indigestible component of carbohydrates with scarcely any nutritive value, and it contributes to dietary fiber. Now, the carbohydrate reserve glycogen of a human adult is about 500 grams. That is, the carbohydrate reserve now of a human adult is about 500 grams. Now, this reserve is rapidly exhausted when a man is fasting. If the dietary carbohydrates do not meet the energy needs of the body, protein and glycerol from dietary and endogenous sources are used up by the body to maintain glucose homeostasis. So you have gluconeogenesis taking place. Now, let's see glycemic index. You must have heard about that before. Glycemic index. Glycemic index of a food is defined by the area under the 2-hour blood glucose response curve. That is, it is defined by the area under the 2-hour blood glucose response curve following the ingestion of a fixed portion of test carbohydrate, that is, under OGTT, oral glucose tolerance test. Now, when a patient is to do the OGTT, it takes a procedure. A specific amount of glucose will be given. Meanwhile, the blood sample will be taken before that test is given. And also the urine will be checked so that you don't have a case of established diabetes, and you don't go and load the patient with glucose in addition to the already worsening case of diabetes. So you take the blood sample, you take the urine, and then immediately after taking the blood sample, you give the patient 70 grams of glucose. And after that, you take another sample, 1 hour time and another 2 hours time. So you put together, you have this to check the tolerance, and then you draw the curve. The concept has practically changed the way and manner cases like diabetes is monitored. And we see that it has also provided a concept that is practically of utility in management of diabetes and the control of obesity. And the classification of foods according to glycemic index is very important. And so, we have seen glycemic index, and we understand what glycemic index is right now. So, the glycemic index of a food is defined by the area under the 2-hour blood glucose response curve. Next is dietary fiber. Dietary fiber. By definition, dietary fiber is the remnants of the edible part of plants, analogous carbohydrates that are resistant to digestion and absorption in the human small intestine, with complete or partial fermentation in the human large intestine. Now, it includes polysaccharides, oligosaccharides, lignin, and associated plant substances. I'm sure you already know what is fiber from the local palace. It's essentially known to have no nutrients. And here we see that dietary fiber is the remnant of the edible part of plants, that part that cannot be digested. It is resistant to digestion, and it's also resistant to absorption in the human small intestine, with complete or partial fermentation in the human large intestine. So we have seen it includes polysaccharides, oligosaccharides, lignin, and associated plant substances. Now, dietary fiber consists of one or more of either losartan, blood cholesterol attenuation, and or blood glucose attenuation. So organic acids and polyols are also considered as part of fiber, but animal foods do not contain any fiber. Animal foods do not contain any fiber. So what are the types and sources of dietary fiber? Dietary fibers, we are talking about types and sources of dietary fiber now. So dietary fibers have been characterized by its source, example, cereal, vegetable, and fruits, or its solubility in water. Both characteristics or characters of solubility are essential for health promotion. Digestibility of fiber is determined by physiochemical and structural properties of the dietary components and the process used. Dietary fiber is known to be associated with reduced incidence of coronary heart disease, that it is associated with good heart. It promotes, better function of the heart. And so that's why it is associated with reduced incidence of coronary heart disease. Now, the mechanism of its action is attributed to its binding to bile salts and preventing its reabsorption, and thus reducing cholesterol level in circulation. So you see the importance of dietary fiber as it helps to reduce the cholesterol level in circulation. The fiber, particularly the gum and pectin, when ingested with a diet, are reported to reduce postprandial glucose level in the blood. So recent studies have shown that gum present in fenugreek seeds, which contains 40 gram or 40% gum, is mostly effective in reducing blood glucose and cholesterol levels as compared to other gums. So fiber have no metabolic effect. However, too much of fiber can decrease the absorption of valuable micronutrients. So when there is too much of fiber, it will prevent the absorption of micronutrients from the body, although it will reduce cholesterol circulation. So it must be such that we do not abuse it, because vice versa, it comes with its effect. So there is a conflicting kind of view concerning fiber. Why? Because there is a view or conflicting evidence as to whether fiber tends to bind some vitamins and minerals like calcium, magnesium, iron, and zinc, and reduce their bioavailability. People who eat well-balanced diet obtain enough roughage, considering the qualitative and quantitative decrease in fiber content of diet over the past many decades. An increase in dietary fiber, particularly from cereals, emerged as a recommendation intake in excess of 60 grams of fiber over a day can reduce the nutrient absorption and cause bowel irritation. And so the dietary fiber must not exceed 60 grams of quantity over a day, because it can reduce the nutrient absorption and can cause bowel irritation. So a daily intake of 40 grams of dietary fiber over a 2,000 kilocalories is desirable. So the actual quantity of fiber intake depends upon the nature of the cereals, pulses, whole grain, vegetables, and millets used. So next, we'll be talking about vitamins. Vitamins are a class of organic compounds categorized as essential nutrients, and they are required by the body in very small amounts. They fall in the category of micronutrients, and vitamins do not yield energy but enable the body to use their nutrients. Since the body is generally unable to synthesize them at least a sufficient amount, they must be provided by food, since they are not synthesized in sufficient amounts in the body. And so a well-balanced diet supplies, in most instances, the vitamin needs of a healthy person. So a well-balanced diet supplies, in most instances, the vitamin needs of a healthy person. So when there's a proper balanced diet, you will definitely have the adequate quantity of vitamin supplied for the need of the body once you have a balanced diet. So vitamins are divided into two groups. You have the fat-soluble vitamins, vis-a-vis. They include vitamin A, D, E, K, known as ADEK, and B, water-soluble vitamins, vis-a-vis vitamins of the B group and vitamins C. So you have the fat-soluble vitamins, example are the ADEK, and then you have the water-soluble vitamins, that is the B and C. Now each vitamin has a specific function to perform, and deficiency of any particular vitamin may lead to specific deficiency diseases for some vitamins. No deficiency disease is yet known. Take note of that. But the minimum intake of the maintenance of health in respect of many of the vitamins has been determined, but the optimum intake remains somewhat speculative. So, as a take-home from vitamins, you have come to understand that vitamins are divided into two: the fat-soluble and water-soluble. Under the fat-soluble, examples include vitamins A, D, E, and K. And under the water-soluble, the vitamins include vitamins of the B group and vitamin C. Vitamin A now, let's look at vitamin A. Vitamin A covers both a preformed vitamin retinol and provitamin beta-carotene, some of which is converted into retinol in the intestinal mucosa. What are the functions of vitamin A? Vitamin A participates in many bodily functions. A, that is number one, it is indispensable for normal vision. It contributes to the production of retinal pigments which are needed for vision in dim light. Number two, it is necessary for maintaining the integrity and the normal functioning of glandular and epithelial tissue, which lines intestinal, respiratory, and urinary tracts, as well as the skin and eyes. Number three, it supports growth, especially skeletal growth. And number four, it is anti-infective. There is increased susceptibility to infection and lowered immune response in vitamin A deficiency. So when you have enough vitamin A in your system, you will have a good immunity. And the next one, it may protect against some epithelial cancers such as bronchial cancers, but the data are not fully consistent, as some agree and some disagree to that. However, the role of vitamin A at the molecular level is not yet known. In terms of sources, vitamin A is widely distributed in animal and plant foods. In animal foods, as performed, vitamin A retinol, that is the preformed vitamin A, which is known as retinol, you see that in animal foods. And in plant food, you see it as provitamins, that is the carotenes. Provitamins, that is the carotenes from the plant source. You also find vitamin A in fortified foods, that is fortified foods with vitamin A, example your vanaspati, margarine, and milk. They can be an important source of vitamin A content or selected foods. Now let us see the deficiency. But before then, the liver has an enormous capacity of storing vitamin A. Take note about that. Mostly in the form of retinol palmitate under the normal conditions. as well as fed persons have sufficient vitamin A reserves to meet his needs for 6 to 9 months or more. So free retinol is highly active but toxic and is therefore transported in the bloodstream in combination with retinol binding protein, which is produced by the liver. In severe protein deficiency, decreased production of retinol binding protein prevents mobilization of liver retinol reserves. So this is clearly specific in a severe protein deficiency. So the decreased production of retinol binding protein prevents mobilization of liver retinol reserves. Now let us see the deficiency of vitamin A. Deficiency. The signs of vitamin A deficiency are predominantly ocular. They include night blindness, conjunctival cirrhosis, bite spots, corneal cirrhosis, and keratomalacia. Now the term xerophthalmia, that is dry eye, comprises all the ocular manifestations of vitamin A. And when I mean ocular manifestations, that is challenges with the eyes due to vitamin A deficiency, which is ranging from night blindness to keratomalacia. Now, night blindness is number 1, conjunctival cirrhosis number 2, bite spots number 3, corneal cirrhosis number 4, and keratomalacia number 5. So take note, this is very important concerning the cause of the deficiency of vitamin A. So that's well said. We will be discussing vitamin D right now. Vitamin D. So, the nutritional important forms of vitamin D in man are the calciferol, your vitamin D2, and co-calciferol, vitamin D3. Now, calciferol may be derived by radiation. Now, irradiation of the plant sterol, that is ergosterol. So, when you carry out irradiation of the plant sterol or ergosterol, you will have calciferol. So cholecalciferol is the naturally occurring preformed vitamin D. The naturally occurring preformed, that is the initial form of vitamin D, which is found in animal fats and fish liver oils. It is also derived from exposure to UV rays of the sunlight, which convert the cholesterol in the skin to vitamin D. And vitamin D is stored largely in the fat depots. Now let us see the association between vitamin D and kidney hormone. Vitamin D and kidney hormone. So major advances have been made in recent years in our understanding of the metabolism of vitamin D in the body. It is now known that vitamin D by itself is metabolically inactive unless it undergoes endogenous transformation into several active metabolites, first in the liver and later in the kidney. These metabolites are bound to specific transport proteins and are carried to the target tissues, bone and intestine. It is being proposed that vitamin D should be regarded as a kidney hormone because it does not meet the classic definition of a vitamin, that is, a substance which must be obtained by dietary means because of a lack of capacity in the human body to synthesize it. In fact, vitamin D3 is not a dietary requirement at all in conditions of adequate sunlight. It can be synthesized in the body in adequate amounts by simple exposure to sunlight, even for 5 minutes per day. Let us see the functions of vitamin D. In the intestine, it promotes intestinal absorption of calcium and phosphorus. Intestinal absorption of calcium and phosphorus. In the bone, it stimulates normal mineralization, enhances bone reabsorption, affects collagen maturation. In the kidney, it increases tubular reabsorption of phosphates, variable effect on reabsorption of calcium, and permits normal growth. In terms of deficiency, when there is deficiency of vitamin D, it can cause rickets. The deficiency of vitamin D will lead to rickets, which is usually observed in young children between the age of 6 months and 2 years. And this is evident in the reduced calcification of growing bones. The disease is characterized by growth failure, bone deformity, muscular hypotonia, tetany, and convulsions due to hypocalcemia. There is an elevated concentration of alkaline phosphatase in the serum. The bony deformities include curved legs, deformed pelvis, pigeon chest, Harrison sulcus, rickety rosary, and then the one you know as kyphoscoliosis, and many others. Now, the milestones of development, such as walking and teething, are also delayed in children that lack or have vitamin D deficiency. Now, number 2, as part of the deficiency of vitamin D, you have osteomalacia. In osteomalacia, in adults, vitamin D deficiency may result in osteomalacia, which occurs mainly in women, especially during pregnancy and lactation, when requirements of vitamin D are increased. That time, the need is high and the body does not have it. So both rickets and osteomalacia are frequently reported in countries, although they do not appear to be a problem of public health importance. In the world as a whole, their prevalence has declined as a result of changes in social customs and improvement in healthcare intervention, and the expansion of mother and child health services, leading to better care and feeding of infants and children. In the developing countries, today, as we have it, rickets as a menace to child health is overshadowed by the prevalence of protein energy malnutrition. So how can we prevent the deficiency of vitamin D? Prevention measures include, number 1, educating parents to expose their children regularly to sunshine. Number 2, periodic dosing prophylaxis of young children with vitamin D. And number 3, vitamin D fortification of foods, especially milk. Some industrialized countries still carry out the last measure, that is the fortification of foods, especially milk. So periodic dosing and education appear to be the most practical approaches of prevention in developing countries. So vitamin D is stored in the body in fatty tissues and in the liver. An excessive intake is harmful and may result in anorexia, nausea, vomiting, thirst, and drowsiness. So the patient may lapse into coma, while cardiac arrhythmias and renal failure may occur. The effects are due to hypercalcemia induced by increased intestinal absorption and mobilization of calcium from bone. So recent literature contains warning against the administration of amounts of vitamin D that greatly exceed accepted requirement levels. So this warning applies to pregnant women also, since manifestation of hypercalcemia may likely develop in uterus. Next, we will be seeing the daily requirement for vitamin D, particularly in the urban group, like 1 to 2 year old children. A specific recommendation of daily supplement of 400 international units of vitamin D is suggested. 400 international units of vitamin D is suggested. In other ways you can put it, it simply means 10 microgram of vitamin D is suggested. Now let us see vitamin E. Vitamin E, that is known as tocopherol. Now vitamin E is the generic name of a group of closely related and naturally occurring fat-soluble compounds, the tocopherols. Of this, alpha tocopherol is biologically the most potent. Vitamin E is widely distributed in foods. By far the richest sources are vegetable oils, cotton seed, sunflower seed, egg yolk, and butter. Foods rich in polyunsaturated fatty acids are also rich in vitamin E. Therefore, the usual plasma level of vitamin E in adults is between 0.8 and 1.4 milligram per 100 ml. While there is no doubt that man requires tocopherol in his diet, there is no clear indication of dietary deficiency. So the role of vitamin E at the molecular level is little understood. And the current estimate of vitamin E requirement is about 0.8 microgram per gram of essential fatty acids. So this roughly works out to 8 to 10 milligram tocopherol per day, depending on the edible oil that is used. But recently, in the cytotoxic effect of vitamin E on human lymphocytes, in vitro at high concentrations has been reported. This being so, caution should be exercised against the mega dose consumption of vitamin E in clinical practice. Next is vitamin K. Vitamin K. Vitamin K occurs in at least two major forms, vitamin K1 and vitamin K2. Vitamin K1 is found majorly in fresh green vegetables, particularly the dark green ones, and in some fruits. Cow milk is a richer source of vitamin K than the human milk. Vitamin K2 is essential and it is synthesized by the intestinal bacteria, which usually provides an adequate supply in man. So long-term administration of antibiotic doses for more than a week may temporarily suppress the normal intestinal flora. So the vitamin K2 will not be produced for those period of time because it has been suppressed. And it may cause a deficiency of vitamin K, and vitamin K is stored in the liver. Now, the role of vitamin K is to stimulate the production or the release of certain coagulation factors. In vitamin K deficiency, the prothrombin content of blood is markedly reduced, and the blood clotting time is considerably prolonged. So when somebody has an injury and there's a deficiency in potassium, what will happen? There will be a long bleeding time, and the wound will not heal quickly. So the vitamin K requirement of man is met by a combination of dietary intake and microbial synthesis in the gut. The daily requirement for man appears to be about 0.03 milligram per kg for the adults. Newborn infants tend to be deficient in vitamin K due to minimal stores of prothrombin at birth and lack of an established intestinal flora. Soon after birth, all infants or those at increased risk should receive a single intramuscular dose of a vitamin K preparation. That is 0.1 to 0.2 milligram of menadione sodium bisulfate. And this essentially takes place during the immunization period. So that is that with vitamin K. So in the next class, we'll be talking about minerals. Minerals. Now we are dealing with carbohydrates. The third major component of food is carbohydrates. And this is the main source of energy, providing 4 kilocalories per gram. Carbohydrate is also essential for the oxidation of fats